Hi, I'm Dr. David Rowe from Rowe Chiropractic Offices, and we're going to look at Eva's x-rays. And we were just speaking with Eva, and she was telling us about her experience with her chiropractic care and how when she began chiropractic with the other chiropractic biophysics doctor, that she was having severe vertigo, neck pain, and eventually she had developed headaches. Now, she got a lot of relief from that great practitioner's care. When she began with her in our office, she still had bad symptoms, but they had substantially improved. Now, when we look at this x-ray here, is the side view of her neck of the x-ray that she brought into the office. When you're facing this way, we're supposed to have a curve in the neck like this. That's represented by this green and this yellow line. That's the normal curve. Let's just make a little model of it like this. This would be the curve of the neck, and the spinal cord, which is the extension of the brain, sits on the inside of the curve. When the structure's like this, the spine's upright, the structure's strong, but most importantly, the spinal cord is relaxed in that curve, just gushing information from brain to body and back again. It's communicating through the spinal cord, through this curve. Now we see that the green line is normal, she's the red line, she's reversed. So the spinal cord isn't sitting like this, it's like this, and it's being pressed up against the curve is pushing up against the cord, interfering with the normal communication. Creates all kinds of symptoms. She had vertigo, she had migraine headaches, she had neck pain. All that's being caused because of the misalignment in the spine. So when she came into our office, this is the x-ray, the starting x-ray. We gave her a adjustment routine. We gave her therapeutic exercises that were specific for this pattern. We did an in-office traction to pull the curve back in the neck, and we had her use a home traction unit to support that process. We worked together for several months, and we look at this comparative x-ray. Now, once again, green is normal and she is red. Now, you see she's building the curve back here, but from here, she still has reversal. If I cover this part up and I just look down here, wow, she's getting a really nice curve back. But if we cover this up, the correction, there's still quite a bit of reversal and quite a bit of work to do. But as the curve starts to return towards normal, we go from this reversal to the curve starts to come back, the spinal cord is able to start to relax. It sends better communication, the symptoms begin to reduce, her body starts to heal. But of course, we want to continue that process. All right, let's look at the numbers associated with this. Now, this comes from a x-ray marking system called PostureRay. It's a great program. It really helps the practitioners focus in on evaluating vertebra to vertebra and measuring the whole curves to see, compared to our normal, how is this patient doing. Now, C stands for cervical. That's the neck vertebra. And we know that if we measure it from the top of the neck to the bottom of the neck, ideally, it should be normally minus 42 degrees. What does minus mean? These are minus, curve like this. If the curve was reversed, it would be in the plus. The research from chiropractic biophysics also tells us about what's each individual vertebra ideally supposed to be, so we can compare a patient's values, how we take their x-ray to see how it compares to normal. So each vertebra should contribute around minus 8 degrees, a little bit more curve up here at the top at C2, C3. That's how we get the neck curve. Now, these were Eva's initial x-ray measurements. And we see this one, wow, I say, wow, doc, there's too much curve there. Yeah, so what's happening, let's say this is one vertebra, this is another, the disc is between them. That vertebra subluxated like this. That's part of like the Gonstead model of an individual joint subluxation where it misaligned like this. That's why it's overcurved. But when this reversed in overcurve, the vertebra above it began to reverse and go into that plus position. We see what's supposed to be minus 8 is plus 8.5. What's supposed to be minus 8 is plus 6.4. What's supposed to be minus 8 is, this is the worst of the worst, plus 12.4. So we come up with the exercise, the therapeutic exercises, the in-office traction, the home traction. We worked for several months, and these are the values on x-ray 2. So this is from a segment that we're adjusting near to correct that subluxation. The minus 16 improved somewhat to minus 13.7. That helps the process along. The 8.5 improved to 2.4. Now say, well, why is that improving? Remember, if you're in the plus and you're trying to get to the minus, you have to get down to 0 before you then can go into the minus. The plus 6.4 has reduced to plus 3.8, and the worst of the worst, the plus 12.4 has reduced to plus 2.0. Not perfect, but well on our way to healing. Now, it's really interesting that the symptoms can improve long before the actual correction. But of course, we want to correct it as far as we can so that she can get the best response. Let's look at other contributing parts to her spinal posture that are adding to it. This is a front view of the neck. Now, this is the left side, this is the right side, so she's facing it this way. Green is normal, she is red. We see the head is shifted, and what makes this position is she's shifted to the side like this. So we create a therapeutic exercise to push the head in the opposite direction. We take this comparative x-ray, a modest improvement, but it's moving in the right direction. She also had subluxations lower down in the spine that were also contributing. This is the side view of the low back. Now, in the side view of the low back, we're also supposed to have a negative curve there. It's supposed to, when I say negative curve, it's in the minus. The normal is this green line, but she was this red line. So this over curving in her posture in the low back creates one more stress that makes it that much more difficult to correct the neck. So we also create some kind of correction to the low back because we're trying to really fix her from toes to nose, fix the whole posture. Working for several months, we see that gap has reduced to this gap. So it's improving in the right direction. We're always trying to take care of the whole patient. Now, but the real focus with Eva is the side view of the neck. We'll go back to that one. Super. Okay. So she's got this reversal of the neck curve. We've been working for several months. It's improving. We say like, oh, but her symptoms are going away. Would that be a good time to release her from care? Our model is that we're trying to correct the subluxation as much as we possibly can to take the stress off the spinal cord so the body can function normally. Yes, of course, we want to help patients with symptoms, but most importantly, we want to create optimal health and wellness. We want the patient to function at their absolute best. So we correct it as far as we possibly can, then we stabilize it, and then we encourage patients to be on a lifetime wellness program to keep the correction so their body can really repair and they can be the healthiest version of them ever. That's how it works.